So good afternoon. Today I'd like to provide our daily update on COVID-19 testing and hospitalizations and share some details around our strategy to assist nursing homes across the Commonwealth. With respect to testing, Sunday's report recorded 9,255 tests conducted in Massachusetts. The number of new confirmed COVID-19 cases came in at 1,590. That represents a 17% positive test rate on the tests that were processed and released yesterday. We've now conducted about 236,000 tests. We have about 55,000 positives, which represents a positive test rate of about 23%. We obviously pay a lot of attention to that number as well as to the hospitalization numbers that we report on here daily. As of April 25th, there were 3,879 patients hospitalized statewide for COVID-19. That's a small increase over the previous day. As we've said before, a big part of our assumption about social distancing and essential business operations and stay-at-home advisories was all about taking the verticality out of the peak, run up to the peak, and we clearly have done that. We flattened the curve, but the flat curve basically means it's been riding up like this for a while. It seems to have plateaued, depending upon which part of Massachusetts you're in, and what the expectation is it will start to fall. But it will probably fall slowly the same way it ramped up slowly. Currently, about 7% of those who test positive require hospitalization statewide. The state's hospitalization rate has remained relatively stable, somewhere in that 7 to 10% range for the past week or so. Massachusetts hospitals, I think as everybody knows, significantly increased their bed capacity and now have about 18,300 beds available across the state, including the temporary field hospitals. 56% of those beds remain available to patients. And I do want to point out that on the call, we do a daily call with hospitals here in the Commonwealth. And I do want to point out that several of them said that they were seeing an increase in some of the activity that did not involve COVID-19, which we view as a positive sign. As I said last week, the folks at Bay State Medical Center last week had about 150 COVID-19 patients in their hospital. They also had 400 people who were there for other reasons. I think the numbers across our hospital community would be relatively consistent in the sense that they continue to do many things for many people that don't have anything to do with COVID-19. And while we pay a lot of attention to this data because it's critically important to our ability to make sure that we can deal with the COVID-19 population as that population surges and plateaus, we continue to have significant capacity across our healthcare and our hospital system. And if people are sick, they should reach out to their clinician. If they're deeply concerned about their health status, they should definitely go to the emergency room. There are people there who will treat you and take care of you. 56% of our beds remain available for patients. And as of yesterday, we've delivered over 6.5 million pieces of PPE, which includes masks, gloves, gowns, and ventilators that have been distributed to organizations, healthcare workers, first responders, and others. And we continue to aggressively pursue all supply chain avenues with respect to that. With respect to nursing homes, Massachusetts has unfortunately evolved into a national hotspot for coronavirus. Similar to other states, nursing facilities have been hard hit by this insidious virus that's particularly tough and lethal for older adults. In total, there are 386 nursing homes in Massachusetts, 255 assisted living residents, and 93 rest homes. There are approximately 38,000 residents in nursing homes, 16,500 residents in assisted living facilities, and approximately 3,000 in nursing homes. To date, 10,031 residents and staff working in long-term care facilities have tested positive for COVID-19 in approximately 300 facilities. These facilities represent about 56% of the state's total COVID-19 deaths. The numbers are tough to comprehend, but they illustrate the lethal grip COVID-19 can have on seniors, and especially on those with underlying health conditions here in the Commonwealth. And obviously, our deepest condolences go out to the families, loved ones, and staff who have been impacted by this horrible virus. Our command center has a dedicated team that's focused solely on supporting long-term care facilities. The nursing home industry makes up an entirely privately owned and operated collection of providers. And while they must follow state and federal guidelines, there's a wide range of variance on the way homes operate. Early on, our administration implemented a series of regulations, including strict restrictions with respect to visitors and screening guidelines for staff. The Department of Public Health has been assigning an epidemiologist and nurses to support the staff who are currently working directly with residents when an outbreak occurs. On April 7th, our administration announced the launch of a mobile testing unit for long-term care facilities through the Massachusetts National Guard. This resource significantly expanded testing for residents and staff with minimal disruptions in care delivery and service. To date, the mobile testing unit has conducted testing at more than 400 facilities, including nursing homes, rest homes, and assisted living residences, and they've completed a total of over 18,300 tests for staff and residents at those locations. The Guard's done a tremendous job so far and will continue this work to reach as many facilities as possible so that we can get the best information about where the virus is present. As needed, the state has stepped in to assist nursing facilities to respond to the pandemic. This includes the aforementioned expanded mobile testing, robust PPE distribution, crisis management support, rapid response clinical teams, and the activation of a nursing home family resource line. To help address staffing shortages, we launched the long-term care portal to help facilities match with available staff and funded a signing bonus for those who signed up through this portal to get hired. We also developed a three-pronged approach to expanded capacity for COVID-19 dedicated nursing facilities. Depending on the circumstances, we've also established fully dedicated COVID-19 facilities, opened empty facilities to support COVID-19 residents, and created dedicated COVID-19 wings within facilities. And while that may not seem like a very long time ago since we introduced many of these supports, we've continued to discuss the issues and concerns of the nursing home industry and the long-term care community with our folks at the Command Center and have learned a tremendous amount about the current challenges that facilities continue to face when managing COVID-19. And today we're announcing new measures, including an additional $130 million available for nursing homes. This is the second round of $130 million, which comes on top of the $130 million that we announced on April 15th. We're also making additional assistance available to help address staffing shortages as well. The new funding will be made available on May 1st to help pay for more staff, implement state-of-the-art infection control, cleaning services, personal protective equipment, and other support services. These funds will be allocated to nursing homes that are meeting a benchmark for certain criteria to ensure these privately operated facilities are working as safely as possible. In addition, we're boosting additional assistance for temporary staff support, including clinical response teams of 120 nurses and certified nursing assistants that can be deployed in teams to facilities in emergency situations. On-the-ground crisis management support from experts, and deployment of the National Guard to help with logistical, environmental, and other support. This is in addition to the mobile testing services they're already providing. These new staffing resources will be available for all nursing homes. Our administrations work closely with the Massachusetts Senior Care Association to create a centralized infection control command center utilizing experts from Hebrew Senior Life and other providers. They will provide direct infection control support to facilities that need help. The Commonwealth's 386 nursing homes come in all shapes and sizes. They offer different levels of care and provide support for their residents in varying stages of health, all the way through to end-of-life care. Nursing homes have a pressing obligation to provide the best care they can for many of our most vulnerable and fragile residents. The introduction of any illness, but especially a virus like this, can be lethal for our elderly and challenging for staff and caretakers. This would be true for the flu or the common cold, but it's been significantly amplified by COVID-19. You've heard me refer before to COVID-19 as an invisible enemy, one that still has leading epidemiologists and infectious disease specialists struggling to understand it. And as I said earlier, our nursing homes have been hit especially hard. Once COVID-19 gets into a facility, it spreads rapidly and in many cases can be undetected for days. I'm sure you all recall that we talked earlier this year about a nursing home we tested that had no symptomatic COVID-19 residents, and with 98 tests, 51% of the 98 we tested came up positive. This requires everyone to be more vigilant about staff and other people working in these facilities. In many cases, staff interact with several residents daily to do their jobs. It makes controlling the disease that much harder, and it also demands a new level of infection control and staffing requirements for our nursing homes so that they can create the safest environment possible. This, of course, is not easy to do, but it's expected, required, and necessary. So with this new funding, we're also putting in place a set of mandatory criteria for nursing homes that operators must adhere to. Some of these requirements include testing all staff and residents for COVID-19, adherence to a 28-point infection control checklist based on Department of Public Health and CDC guidance, meeting PPE requirements, staff requirements, and clinical care requirements. Facilities will be audited to make sure they're meeting these requirements and providing the safest possible environment for some of our most vulnerable residents. Clearly, protecting our most vulnerable citizens in nursing homes, rest homes, and assisted living residents has emerged as among the greatest challenges we face in our fight against COVID-19. This highly contagious, invisible virus has proven to be most dangerous for people over the age of 70 and those with other pre-existing health conditions. This is complicated for facilities where several residents live in close quarters and require attentive care from their providers multiple times a day. This dangerous equation has now resulted in over half of the Commonwealth's COVID-19 deaths. But we will be as aggressive as we possibly can be, working with our colleagues in the long-term care industry to ensure that we're taking all the necessary precautions and providing the resources that are necessary to get this job done. We here in Massachusetts, as I said earlier in my remarks, are still in the surge and very much in the fight against COVID-19. Lieutenant Governor Polito and I continue to be inspired by the determination and perseverance we see from our residents and the commitment of our frontline healthcare workers and first responders who are out there doing the job every day in the fight. We also want to thank the nursing home staff that work diligently to care for some of our most vulnerable residents. And on this one, I can speak with personal experience, both for my mom, who fought Alzheimer's alongside my dad for 10 years, and for the care that's been and support that's been provided to my 91-year-old father. I'd also specifically like to thank Tim Foley and the healthcare workers at 1199 for working with us to support nursing homes. We will keep the fight up all the way to the end, knowing that we'll come out the other side. There will be better times and brighter days. I would ask everyone, as difficult as it may be, to continue to stay at home unless you need to go out, to practice the social and physical distancing that's made such a difference in flattening the curve here in Massachusetts, and to continue to wear a face covering if you can't be distant from others wherever it is you go. I want to thank you again for your cooperation and your hard work, and I'd now like to invite Secretary Sutters to the podium.
Thank you, Governor, Lieutenant Governor. Good afternoon. In addition to the nursing home package the Governor just described, we are also announcing a second phase of funding, $44 million, for our residential service providers who contract with the Commonwealth of Massachusetts across the Executive Office of Health and Human Services, who support some of our most vulnerable clients. I want to first thank the providers and their associations, including the Association for Retired Citizens, the Providers Council, the Children's League of Massachusetts, Jane Doe, ADDP, ABH, as well as SEIU Local 509, who represents frontline and direct care workers in a number of provider organizations, for their strong collaboration with us and on behalf of the clients that they support 24/7 during these unprecedented times. Together, we are committed to safety. This $44 million is specifically to address unplanned for and thus unbudgeted services and items in response to the pandemic, such as increased staffing, overtime, and staffing-related costs, infection control, and personal protective equipment supplies. This money, in addition to the first phase of $95 million that we announced on March 30th, brings the total additional support for residential programs and some other purchase of service programs to $139 million during the COVID-19 public health crisis. We will be seeking reimbursement from the federal government at the 75-25% allocation methodology, which could be up to $105 million in reimbursements to the state. Across the Executive Office of Health and Human Services, a number of agencies work with 238 residential service providers throughout the Commonwealth to ensure the health and well-being of over 20,000, in fact 20,500 individuals, reflecting very diverse populations, including children, youth, and families, and individuals with physical, cognitive, emotional, behavioral health, intellectual, and developmental disabilities, survivors of domestic and sexual violence, and youth in the custody of the Department of Youth Services and Children and Families. Given the diversity and the unique circumstances of each provider organization, providers have taken a multitude of steps to support their workforce and their clients during this time. Examples include offering double time pay to employees working with COVID-positive individuals, or creating COVID-positive units or residential programs, hoteling staff working with COVID-positive patients, providing differential pay, and other such actions. They've invested funding into infection control, including increased housekeeping and terminal cleaning services, plus finding PPE supplies. Therefore, these funds that we announced today acknowledge the actions taken to date and provide reasonable flexibility to providers to meet the specific needs of staff and clients during this pandemic and surge period. However, I want to be clear. It is the expectation that these residential congregate care providers use these increased dollars for staffing, for clinical, direct care, and support staff, infection control, including housekeeping and environmental services, PPE, and other supports, but these other supports have to directly benefit staff. Providers will be required to report to the Executive Office of Health and Human Services on the actual use of these funds. And as you know, and as we have previously stated in press evals, in addition to financial support, the Commonwealth has implemented testing for staff and residents at a range of congregate care settings, and on April 10th began testing at these sites, and to date has tested over 450 program site locations. And testing continues in both our nursing homes and our congregate care sites daily. Thank you. Governor?
Questions?
Governor, are businesses going to be able to reopen on May 4th, or when are you going to make the decision on extending your order?
So as I said in my remarks, we are continuing to see what I would call a plateau with respect to our hospitalization rates, and we believe that it's important for us to create some clarity around this issue with respect to May 4th, and you'll hear from us later on this week on that.
Well, why are you waiting? You had said last week you needed to see what the trend data
Yeah,
showed.
and the trend data
We're a week out now, so why
yeah,
wait?
the trend data remains reasonably high, but obviously whatever decision we make needs to come with a little thought and a plan behind it, so we'll probably put that out later this week.
But is that something you can put out just a few days in advance, or is this something you really need to put out now and give some people some notice on?
We'll be putting some out later this week.
Governor, on the antibody testing, how is that going to work with the random testing? What kind of information could we get from that that would be helpful in this whole thing?
Well, keep in mind that at this point in time, there are antibody tests going on that are not FDA approved in sites all over the country. And the false results of those tests range from, 5% to 35%. There are some that have been approved by the FDA, but even the FDA has issued what I would describe as qualified commentary on them and said that several of them have not gone through what they would refer to as the traditional review and approval process that would normally take place. I think it's critically important for the FDA, and this is something I have talked about, we have talked about collectively, not just here in Massachusetts, but governors generally around the country, that the FDA, especially when it comes to testing, has a bigger and broader role than the one that it's been delivering on so far. And many of us urged Congress to make sure they provided additional funds and support to both the FDA and the CDC in this last round of federal response to the COVID-19 crisis, and they did. But to really ramp up in a big way antibody testing that can be deemed as reliable, okay? The FDA needs to decide, needs to do the work and then decide which tests they view as being the ones that are approved and effective and accurate. And at that point in time, a lot of people, including us, will do a lot more of it. But the research work, for example, that's being done by MGH with the City of Boston is a very particular kind of test that MGH has a lot of faith in and I think is going to yield some useful information. But broad antibody testing needs the federal government and especially the FDA to step up and give states and providers a lot more guidance than we have now so that we can get to a point where we're using a test that doesn't have false readings that can run as high as a third of all the tests that are delivered.
But people go to the health expresses. People go to the health expresses and getting their own tests. And do you think it's going to help the process? If people say, "Oh, I haven't had it yet. I'm fine. I'm not going to expose it to my grandparents or my parents."
I think a test that up to a third of the time is wrong is not very helpful. And the other thing I would say about this, and this is important, okay? Everybody would love us to know lots of things that we don't about this novel virus. One of the things people would love us to know is if you have antibodies, what does that mean with respect to immunity? And the answer to that question is, even from the experts, is we're not sure and it depends, okay? So I think the antibody testing, when the feds come around to telling us exactly which test or which tests they believe will give us the 95% plus accuracy reading, can be really helpful in establishing baselines, okay? But until we have that kind of guidance from the federal government, I worry a lot that people are going to draw conclusions from some of these tests that A, may not be accurate, and B, may not be appropriate conclusions to draw from them.
So let's assume, Governor, you get that test going. Are you putting a framework into place where we could go to CVS, we could go to Walgreens, like you get a flu shot, and get a really large swath of this population tested? Are you working on that?
I think our view is, again, until the FDA gives us more guidance on this, and even when they do give us guidance, what the antibody test is going to tell you is who had it. Now, whether or not they're immune, no one's going to know the answer to that, okay? For me, the big thing is to continue to ramp up what I would call traditional testing. Remember that 6, 7 weeks ago, we were probably doing a few hundred tests a day. We're now doing, we did 9,000 yesterday, and people thought that was a drop-off, okay? And there are people in this state and elsewhere that are working really hard to make it possible to do far more of what we would describe as the traditional accurate tests that have become sort of part of our daily briefings, not just here, but around the country. And I think if you're thinking about it from a forward look, you have to think about testing. You have to think about doing a lot more of the traditional testing, not just the antibody testing. Because all the antibody testing is really going to tell you is who had it. That's nice to know, and it's good to start a baseline, and it will answer one of the big questions we all have, which is how much of the population has actually been exposed to this. But it's not going to answer the question about whether somebody today has it or not. And when you're talking about a virus, and this is another thing, 6 weeks ago, 8 weeks ago, people said, well, there's like a 5-day gestation period where people seem to be asymptomatic. But everybody gets symptoms, which is why the thought at the time was, if you just monitor people's temperatures, you'll know when people are coming down with it. Well, then they started saying, well, maybe that 5% represents people who are never going to be symptomatic. And then they said, well, maybe it's 10% of the people who are never going to be symptomatic. Well, maybe it's more like 20%. And you now have folks who are studying this, both here and in other parts of the country, saying that it's possible that as much as 40% of the folks who get this are never going to show symptoms. That changes everything about what you get out of an antibody test, okay? It's going to tell you who had it. But in terms of who has it today, which are 40% of the people who can get this thing are not going to show symptoms, I want to know how many of those folks, especially if they're in certain lines of work, are going to test positive, because that's going to be important because they're carriers. And that's one of the reasons why we changed our guidance with respect to face coverings and said if you can't socially distance, you should wear a face covering. Not so much, and I know you've heard me say this before, not so much to protect you from other people, but to protect other people from you, because such a significant portion of the population that gets infected with this appears to not show symptoms at any point. So for me, yeah, there's a role with the antibody testing, but doing more of what I would call the traditional testing, and people are doing a lot of work on figuring out how we might be able to dramatically ramp that up, is going to be really important to what we do going forward. Pardon me?
Are you dealing with CVS or the pharmacies, one option?
CVS
I
is,
know some of the other states are doing it.
CVS has been a terrific partner, absolutely.
Governor,
And I'm sure they're going to do more.
are you feeling any pressure?
Daily testing. Do you have a new goal for the number of tests per day going forward?
I mean, we're doing somewhere around 8,000 to 10,000 tests, sometimes as many as 12. I think that's much better than we were doing. But last week when we talked about this, all three of us said that we thought over time we were going to end up doing a lot more testing than that. And I continue to believe that.
Governor,
Governor,
are you
could you
feeling
or-
more pressure as other states
I
begin?
do want to give, yeah.
Thank you. Could you or Secretary Sutter speak to what Western Massachusetts community health centers might end up on board for the expanded testing? I think the Secretary mentioned Caring last week, but they said they ended up not making the list after all. So I don't know if there are any other community health centers on board.
By the way, the one part of Massachusetts that has seen a decline is Western Mass. Not on testing, hospitalizations. Yeah.
Right. Testing. So on the first 12 that we announced, today is Monday. So next week, we will be announcing another group of health centers to become part of the expanded testing in Massachusetts. We just haven't landed on who the next 12 are. There were a couple that we had offered that declined for a variety of reasons, and I won't spot them in public.
Secretary or Governor, I'm not sure who's best to answer this. On the Holyoke Soldiers Home, given the rise in tests and deaths there, how many veterans actually remain at the home now compared to how many are been moved to hospitals at this point?
She can give you I can give you a ballpark. She'll give you the real number. My guess. Somebody want to ask somebody else one? Go
Could I
ahead.
ask a
Yeah.
question? I just wonder, back to sort of the idea of reopening, are you feeling pressure now as other states begin to move toward reopening? Are you feeling some pressure to reopen some businesses?
So, these are morbid statistics, and I apologize in advance for bringing them up, but there are about 55,000 people nationally who've died of COVID-19 since the start of this outbreak. Massachusetts, New Jersey, New York, Michigan represent more than half of that total. There are another 10 states that make up about another 25% of that total. And then you have 40 states that represent about 15 or 20% of the total number of deaths. So, and I talked to governors who fall all the way through this spectrum every week. For the governors who are located in states that have either very low numbers of positive tests or very low hospitalization rates or very low numbers of deaths relative to what we in the Northeast have seen, I'm not surprised that they're starting to think pretty hard about reopening, okay? For them, the surge was nothing like it was in the Northeast. Just nothing like it was in the Northeast. And I think the other thing we've said many times here is that the timing around this stuff varies a lot depending upon what's going on in your state. New York got over the surge about a week ago. New Jersey got over it over the weekend. I mean, the first time they actually started to see a few days of positive trends on negative hospitalizations was over the weekend. Rhode Island expects to see the surge next week. Vermont and New Hampshire both believe they're past the surge. So where you are, I think one of the reasons why the president said, here's some broad guidelines, but states are going to go when states think it makes the most sense for them, was because they were looking at the data from state to state to state and concluding that you can't make a big broad generalization about when it makes sense for states to move here because they're in very different places. And, you know, Montana, I think, has had 12 deaths, North Dakota maybe 18. The numbers vary so much from state to state that you would expect states to act relatively independently based on their own data and to try to work with the states that are around them, as I've said before, to make sure that none of us does anything that unwittingly creates an issue or a problem for other states. But I, generally speaking, when I talk to other governors, if their data is heading in the right direction and their trends are heading in the right direction, they should start thinking about stuff like that. And I would say that for us as well.
But with Massachusetts residents, so, I mean, our state's so close together. If New Hampshire starts to reopen, Massachusetts residents start to go over the border,
Yeah,
whatever
and that's,
they want, and come back.
yeah, but that's part of the reason why we're talking all the time to Connecticut, Rhode Island, New York, New Jersey, Vermont, New Hampshire, and Maine, because we all want to make sure we don't do anything that creates a problem for each other.
Governor, has that coalition met yet? You appointed last week, but has that coalition actually got together on a video conference call?
They've talked several times, yeah.
Governor, last week you said for businesses will be less about a date and more about the rules of the road.
Yep.
Safely reopening. Can you tell us what rules we're considering? Are you having conversations right now?
We've had what I would describe as informal conversations with a bunch of folks on the healthcare side and on the employer side. Folks on the employer side are thinking really hard about this, and many of them, I think I said this last week, are also, if they're part of either a national or a global supply chain, or if they're part of a company that has operations all over the world, they're bringing a lot of what they've heard from or seen in other parts of the world into these conversations as well. And I certainly expect that our go forward is going to involve a lot of conversations, probably on a structured basis around that stuff. Yeah.
Governor,
$130 million.
Go ahead.
Mass Treatment Center in Bridgewater, we found it ranks 8th in the nation for the most deaths in a correctional facility. What do you attribute that to?
I think the biggest issue at the mass treatment, well, a couple things, but I think the biggest issue is the treatment center is a civil commitment facility, which means that the average age of the population there tends to be a lot higher than it is in the rest of the prison population. The other thing I would say is I think people did a lot of really good work there, but that's a much tougher building just given the way it's laid out and the way it's organized than some of the other ones that exist in our existing correctional system.
Some inmates or people there have been released not because of COVID, but because their time is up and what have you, and they have not been tested. Should inmates, before being released back into the community, maybe undergo a test, a COVID test?
It's the first I've heard of that, so I'm going to have to get back to you on that one.
On the $130 million of the nursing homes, which is, I guess, 260 total.
Yep.
Is money flowing to these assisted living facilities as well to help them out?
Well, keep in mind that assisted living facilities, as a general rule, are privately operated, privately paid. They do have, in some cases, state-funded services that are provided on a sort of an as-needed basis. But as a general rule, they're not funded by state or federal funds, to the best of my knowledge, on a sort of daily basis. They're privately operated and privately funded.
Governor, the Steamship Authority wrote to you earlier this month seeking state money to help them keep the ferries running past May. Have you been in touch with them? Are you going to help them out?
So first of all, the Steamship Authority is basically not an entity that we have jurisdiction over for all intents and purposes. And I believe most of their rulemaking and most of their regulatory oversight is federal. And I do know that this is a conversation that's going on currently with a number of similar kinds of entities with the federal government to determine whether or not, in fact, there's a role for the feds to play there. But the states, as a general rule, do not have jurisdiction funding anything to do with organizations like that, but the feds do.
Governor, what are your thoughts about the governor or lieutenant governor, what are your thoughts about remote voting with the legislators talking about this week?
You know, I'm pretty focused on what we're dealing with right now, and I fully expect at some point when we know a lot more about what the facts on the ground look like in the summer and the fall, people can start having a conversation about what they think they need to do to make sure people can vote. But I do expect that a significant number of the votes that are going to get cast at the end of May on those two special elections and the two special elections that are in June, a lot of those are going to be mail-ins. I mean, I fully expect that.
Thank you.
Thanks.